Signs and symptoms of BPH. BPH stands for benign prostatic hyperplasia. BPH is a medical condition in which the prostate, which is a small gland whose primary function is to nourish and transport semen, enlarges. However, in BPH, the growth of the prostate gland is considered benign, which means that BPH does not mean cancer. As you can see in the picture, on the left, it shows the normal prostate gland, and on the right, it shows the condition of BPH, where the prostate gland is enlarged. When this happens, the urethra, the tube which carries urine out of the body, becomes narrower such that the person can have difficulty passing urine out of the body, and BPH can cause urinary retention such that the urinary bladder loses its ability to completely empty itself. Sometimes men can have BPH but be asymptomatic. However, let's take a look at some of the signs and symptoms associated with BPH. Number 1. Frequent urination. This is because when the prostate grows in size, it pushes against the bladder and the urethra. When this happens, urethra becomes narrower and the bladder can weaken and can contract more, and thus the urge to pee becomes more frequent. In men who have BPH, especially at night, they might feel the urge to pee frequently even if their bladder is not completely full. Number 2. Not being able to fully empty the bladder. This is because when the prostate enlarges, it may press against your bladder and cause the urethra to narrow. And over time, your bladder muscles become weak by trying to push urine down a narrow urethra. And when this happens, your urinary bladder may not empty completely when you go to pee. Number 3. Weak urine stream, or a stream that stops and starts. This can happen in the early stages before urination and occurs before the urethra narrows due to the enlargement of the prostate. And because of a weak urine stream, the urinary bladder loses its ability to empty itself completely, leading to urinary retention. Sometimes the weak urine stream can also give rise to feelings of frustration in some men. Number 4. Sudden need to pee, also called urgency. The sudden need to pee can be because of the constant pressure faced by the bladder and the urethra because of an enlarged prostate, or it can also occur because of other medical conditions such as urinary tract infections or bladder stones. Number 5. Finding it difficult to start peeing. Difficulty in starting urination is called urinary hesitancy. Urinary hesitancy develops slowly over time as the prostate enlarges. Swelling and a feeling of discomfort in the bladder are common symptoms of urinary hesitancy. Number 6. Accidentally leaking urine. This can happen because of the pressure faced by the bladder due to the enlarged prostate and also because of changes in the function of the bladder due to BPH such that the bladder becomes overactive. Sometimes this situation can give rise to anxiety as well as social inhibitions. Number 7. Dribbling at the end of urination. This happens because the narrowed urethra due to the enlarged prostate is not being emptied completely and some urine stays trapped in the urethra, which can then result in dribbling at the end of urination. Strengthening your pelvic floor muscles by exercising is a good option to prevent dribbling at the end of urination, as the pelvic floor muscles help to prevent incontinence of the bladder and bowels. Number 8. Blood in urine. Blood in urine, also called hematuria, is another common symptom of BPH. The enlarged prostate can press on the urethra and can thus cause irritation and inflammation in the urinary tract, and this can lead to the presence of blood in urine. However, sometimes the amount of blood in urine can be very small such that it will not be noticeable in urine. Then, doing a urine test can confirm if indeed there is blood in urine or not. Number 9. Painful urination. Sometimes BPH can also result in a burning or painful sensation or discomfort while urinating and during ejaculation. These are the common signs and symptoms of BPH, and it is very important that if you experience a combination of these symptoms, that you go consult a doctor, as there are many options available to treat an enlarged prostate, such as medication or surgery. Now, here are some foods that you can include in your diet to keep your prostate healthy. Sesame seeds and pumpkin seeds are rich in the mineral zinc, which is essential for a healthy prostate. Tomatoes are another food that will help to keep the prostate healthy, as they contain a pigment called lycopene, which can slow the progression of BPH and can even help lower the risk of BPH and prostate cancer. Bell peppers and salmon are also very beneficial, and if you do not eat fish, you can try eating walnuts or ground flax seeds or chia seeds. Lastly, regular physical activity can help in keeping the prostate enlargement in check and can also reduce the risk of BPH and prostate cancer. Until next time, take care.